Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Naura Filza and today I will present about the checklist consort of information to include when reporting a randomized trial. So basically there are 25 checklists and I will show you which checklist section in my article. Firstly, point 1A, identification as a randomized trial in the title. So the title is Effect of Aspirin versus Placebo on the Prevention of Depression in Older People, a randomized clinical trial. Next, point 1B, structured summary of trial design, methods, result, and conclusion. The answer is in this abstract. There are trial design, methods, result, and conclusion. Next, point 2A, scientific background and explanation of rationale. Preventive approach for many non-communicable disorders from cancer to cardiovascular disease have had major influence on incidence, morbidity, and mortality. Next, point 2B, specific objective or hypothesis. There are no evidence-based primary preventive pharmacotherapies for depression. Also, the primary aim of SPD was to determine if the use of low-dose aspirin reduced the risk of depression in healthy individuals 70 years or older or 65 years or older among racial or ethnic minorities in the US, as assessed using the Center for Epidemiology studies the depression scale 10-item scores. The secondary aims were to determine its effect on mental health quality of life as indexed by the 12-item short from health survey mental component summary scores and assess the time to a first CES D10 scores of 8 or more, as well as incidence of hospitalization for depression. The primary hypothesis was that low-dose aspirin would reduce the risk of depression, defined as a CSD-10 score of 8 or more at any post-randomization point. Next, point 4B, setting and location where data were collected. The data were collected in Australia and in the US. Next, point 3A, description of trial design, including allocation ratio. The ASPRI trial was a multicenter, double-blinded, placebo-controlled, primary prevention, randomized clinical trial. Next, point 4A, eligibility criteria for participants. Among older adults who were relatively healthy and community dwelling in Australia and the US and were 70 years and older or 65 years or older if African American or Hispanic and dwelling in the US. Next, point 8B, type of randomization, details of any restriction. Randomization of the study drug followed a block randomization procedure and was stratified by site and age. Next, point 10, who generated the random allocation sequence, who enrolled participants, and who assigned participants to intervention. The trial was conducted according to the Australia National Statement on Ethical Conduct in Human Research. Next, point 5, the intervention for each group was sufficient details to allow replication, including how and when they were actually administered. The answer participants were randomized to receive either 100 mg of enteric coated aspirin or an enteric coated placebo. Point 6a completely define pre-specified primary and secondary outcome measures, including how and when they were assessed. The principal outcome variable of SPD was a proxy measure of major depressive disorder defined as a CSD-10 score of 8 or more. Because some participants may have had a CSD-10 score of 8 or more at baseline or a history of depression. This primary outcome pool both incident and recurrent depression. The CSD-10 is a validated self-rated questionnaire with a single-factor structure that indexes depressive symptom severity in community population. Next, point 11b, if relevant, description of the similarity of intervention. When compared with a formal psychiatric diagnosis of late-life depression, the scale has been shown to have a sensitivity of 97% and a specificity of 84%. Against a formal DSM for diagnosis, the sensitivity and specificity of the CSD-10 were 82% and 83% respectively. Next, point 12a, statistical methods used to compare group for primary and secondary outcomes. The G models, assuming Gaussian distribution with identifying function, were used for analyzing the SF12 mental component. The G models account for within individual repeat measure using unstructured working correlation matrix and etc. in green highlight. Next, point 3b, important change to methods after trial commencement with reason. The CSD-10 was initially administered at baseline and at years 1, 3, 5, and 7. On receipt of further funding, National Health and Medical Research Council identifier, we added CSD-10 assessment to years 2, 4, and 6. Participants were thus assessed for depression annually until the end of their participation in the study. Next, point 6a, completely define pre-specified primary and secondary outcome measure, including how and when they were assessed. The mental component summary score was a secondary outcome measure of SPD. Next, point 7a, how sample size was determined. The target SPD sample size was 1900. To assess power for the SPD primary hypothesis, we extrapolated from the extant literature that the risk of prevalent depression at any time in the placebo group would be 10%. We anticipated a 5% annual dropout rate and a within participant correlation of 0.60 between baseline and follow-up measurements of depression using a compound symmetry matrix. Based on this assumption, we had 90% power to detect the specified difference in depression risk and etc. in pink highlight. Next, point 13a, for each group, the numbers of participants who were randomly assigned received intended treatment and were analyzed for the primary outcome. A total of participants in the US were recruited from March 2010 to December 2014 and randomized to receive aspirin or placebo. Next, point 14a, that's defining the periods of requirement and follow-up. March 2010 to December 2014. Next, point 18, results of any other analysis performed including subgroup analysis and adjust analysis, distinguishing pre-specified from exploratory. Subgroup analysis of these participants showed no significant difference in the prevalence of depressive symptoms at annual follow-up. Further exploration showed no specific pattern in baseline adjusted depressive symptoms ratios at annual follow-up. Antidepressant use was not statistically different between treatment groups at baseline or across annual follow-up. Point 15. A table showing baseline demographic and clinical characteristic for each group. The answer is in this table in green highlight. Next, point 22. Interpretation consistent with result, balancing benefits and harms, and considering other relevant evidence. ASPRI study in ascertaining endpoints and maintaining follow-up. This suggests that low-dose aspirin is unlikely to be effective in preventing depression in a healthy older cohort. Next, point 16. For each group, number of participants included in each analysis and whether the analysis was by original assigned group. The answer is in this table in yellow highlight with data. Next, point 17a, for each primary and secondary outcome, result for each group, and the estimated effect size and expression. The answer is in this table in pink highlight. Next, point 20, trial limitations, addressing sources of potential bias, impression, and, if relevant, multiplicity of analysis. The fact that the ASPRI cohort had higher baseline quality of life than is noted in other population-based studies of older adults probably suggest biased requirement in favor of individuals who are healthy, a reflection of these primary prevention studies exclusion criteria. Next, point 19, all important harms of unintended effect in each group. In this research, the important harms or unintended effects was not found. Next, point 25, sources of funding and other support role of funders. The ASPRI study is funded by a project grant from the National Health and Medical Research Council. The ASPRI parent study, which required a participant and was responsible for all follow-up measurements, including clinical endpoints and other data captured, was funded primarily by a grant from the U.S. National Institute on Aging, with additional support from Australia's National Health and Medical Research Council. Additional funding was received via a National Health and Medical Research Council Senior Principal Research Fellowship and program grant, the National Institutes of Health and the Heart Foundation. Next, point 23, registration number and name of trial registry. The aspirin in reducing even in the elderly trial is registered on the International Standard Randomized Control Trial Number Register. The ASPRI trial had multiple institutional review board approvals in the US and Australia. And point number 6B, 7B, 8A, 12B, 13B, 14B, 17B, 19, 21, and 24 was not found in this article. I think that's all. I have shown you which checklist shown in my article. Sorry if there are a mistake. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.